Hip pain can be a disabling condition, having a major impact on a person's quality of life. Once conservative treatments are tried, hip replacement could be the solution, but not for all hip pain, according to Dr. Eduardo Gomez of Lee Memorial Health System.
Hip pain can actually represent a variety of different things. Pain in the groin is a very common finding with advanced arthritis of the hip, but pain in the groin does not by definition imply advanced hip arthritis. Some people get groin pain associated with lower back problems, spinal stenosis, bulging discs, and therefore the symptoms radiate from the lower back, even though it is felt predominantly in the area of the hip or buttock. We also see a very common source of hip pain to be hip bursitis, which is pain more on the side of the hip and must be distinguished from the arthritis because the treatment is much easier, certainly for bursitis and sometimes even for the back issues.
How are hip problems diagnosed?
Basically, we examine the patient with something as simple as watching them walk, and then we move the hip around and we palpate and check for issues like hip bursitis or back problems. We check for sciatic issues with the physical examination. And when we identify what appears to be range of motion limitations that are consistent with hip arthritis, of course an x-ray is certainly appropriate. That's typically done on the first visit. But sometimes when the x-rays show, let's say, early arthritis or what appears to be early arthritis, the MRI may show far more severe findings of bone spurs, fluid buildup, and things like that that can be indications that the arthritis is more advanced than it appears, and certainly would explain a patient's limitations. When the joint is destroyed, hip replacement is certainly an appropriate option and the most appropriate solution. It's actually recognized as one of the most effective operations in terms of the cost benefit and the benefit to the patients. And so it's an extremely well tolerated procedure that people get through very nicely as far as joint replacements go. Hip replacement is one of those better recoveries, let's say.
Dr. Gomez discusses what can cause arthritis of the hip.
Arthritic conditions of the hip can result from multiple things, such as hip dysplasia, things that we've mentioned, the trauma, the avascular necrosis, and genetic predisposition. That's probably the most common cause of arthritis that we see is a familial tendency towards arthritis. Mom and dad had it, grandpa had it, now you have it, you know. And not uncommonly we see people with this type of family history. When the findings come on, I mean, again, at any decade really, probably most common in the peak incidence would be 60s and 70s for sure. We just basically determine how best to treat it based on their functional limitations. It's time to have a hip replacement when it's curtailing your ability to do the things you need to do and want to do.